The EpiPen seeing a triple-digit price hike, and Mylan CEO is under fire for her hike in pay. Heather Bresch seeing a 671% increase in the same 9 years that she has been in charge. Is the outrage about this justified? For Carrie Sheffield and Countdown host Liz Claman, along with Scott Martin. Let me start with you, Liz, because you've been all over this story. It's an interesting story, particularly for us as a business network. Some are saying this is just capitalism. Some are saying, no, this is something different.
We get the whole capitalism issue where, hey, you've got a great product with a moat of competitiveness around it. Why not charge what you can if nobody else can get in? However, you're talking about life and death situations. The EpiPen is the auto-injector. The actual epinephrine that goes in it, there's no monopoly on that patent. Anybody can buy it. It's just that children and school nurses and EMTs are desperately reliant on this, and none of the technology has changed since the years ago, 1977, when it was actually introduced. Mylan bought the company that owns it in 2007, and since then they've suddenly raised the price from what was for a single injection $57 to magically jacking up the price in some cases as high as $700 for a pack of 2. So everybody's looking at Mylan. Mylan has remained silent. We have put in multiple calls to them about this, and 15 million people suffer from allergies, and so many children are in that 15 million. It's 2 in every classroom. You don't want kids dying, and by the way, they also conveniently expire after a year, so sometimes people don't even use it, have to buy brand new ones. Mylan needs to address this.
So, Carrie, how would they address this? Again, understanding that we've argued for years and years on this channel that businesses go in business to make a profit, and they try to take advantage of the marketplace. What's their responsibility? Creating drugs, or in this case, buying a drug, and also returning the best profit possible to shareholders.
Well, yes, and we did see the price spike in the shareholder price after the increase. So the market was responding.
It's actually been down 5% since the scandal.
Right, but initially,
it's down 20%
but after the initial, there was a jump in the stock price. But I think there is short-termism happening here. So I used to be a Moody's analyst, where we're very concerned about the fundamentals. And I think fundamentally, if you're a business that is going to be overcharging and doing these huge price hikes, especially for children, as you said, Liz, that's going to raise red flags from a judgment perspective, from just the board. Why is the board allowing such enormous hikes happening at such? Your industry is dealing with people's health, and so it's a PR crisis. It's just a judgment call crisis. And I frankly think that, I don't want the government intervening and setting prices, but honestly, the government is distorting the marketplace by subsidizing a lot of this. And so people think that it's free, which is the Mylan's justification, is that it's actually not more expensive to the consumer.
Well, someone is paying, whether it's the families, the household, and we know families are going without. Scott, the average drug costs $2.9 billion to develop and bring to market. There's a competitor out there called Antares. At the beginning of the year, they said they should get FDA approval for a generic version of this sometime really soon. It could be any day now. Mylan's window of opportunity is counting down every day. Do they have a right to try to squeeze every nickel out of this until there's going to be a generic version and there will be no profits for them to be made?
Well, listen, I'm all for drug companies requiring more funds or more payment, let's say, for demand as it relates to their product. But, I mean, what Mylan has done is out of control. I mean, we have a blueprint for this, guys. Remember Turing Pharma? You remember Pharma Bro, Martin Shkreli, just a few months ago? I mean, that whole thing about how those prices blew up obviously did not do the company well, and I think Mylan's in the same position. Don't forget, Mylan's had trouble with their generic side, so the EpiPen was actually probably a savior to the stock, to Carrie's point about how the stock has performed, because the generic side is not doing well. So, Charles, they had to do something, but with regards to tripling or quadrupling the price since the passage of the ACA wasn't the right move to make.
Well, the CEO's pay is up 670% during that same time period. The stock's only up 125%, and everyone thinks this is despicable, even Shkreli, I think. All right, guys, thanks a lot. Next, the New York Times and other